Cannabis-based medicine is a new kind of field in medicine that's been discovered over the past 20 years. This system, the endocannabinoid system, was found to exist in our body only at the last few years of the 20th century. It was discovered in the late 90s, and its clinical application is becoming more and more apparent over the past 10 years. And now we are finding an indication for those medications in almost each and every field of modern medicine. Cannabis-based medication or cannabis-based medicine is the medicine that involves the use of the ancient existing planet and its chemical derivatives, the cannabis, and its use in multiple medicinal applications, from pain to psychotherapy and psychology and psychiatric illnesses, to anxiety, to sleep, and even in the autoregulation of the endocrine system. So that's why it is an exciting new venue in modern medicine that is expanding. Now, there are many applications or ways to utilize it. Historically, we know that cannabis has been smoked. There are ancient stories or literature of the smoked cannabis in the ancient Chinese medicine, in the ancient Mesopotamia medicine, in the ancient Egyptians literature, and hence its use for recreational or non-medicinal usage were inhalational as well. So the first way we've kind of tried to utilize it is through smoking, is through vaping. But now there are many other ways that are finding its way to modern medicine. There are the tinctures, the oils. There are a few companies who started developing tablets and even transdermal, and the most recent one is transvaginal pessaries for endometriosis and gynecological indications for the use of the cannabis-based medication. In each and every field of medicine, we are identifying ideal candidates for the use of this medication. It's started in the kind of trial and error approach, but the main issue that we tried to treat in all those medical problems was pain, and hence pain medicine is in the front line of the new users of the this new system, the cannabis-based medication and the endocannabinoid system. Due to the fact that this is a new treatment, there isn't that long history of its use, and there are still questions about the long-term impact, the safety, the clinical trials, and the number of cases to reflect its benefit versus its potential harm. It's left as a third line in the management of pain. So it is helpful for patients, or actually, if we go by the words of the law, we are allowed to prescribe those medications to patients who are suffering from long, intractable pain problem that fail to respond to at least two of the commonly used approaches and painkillers or medications. And that is actually, in reality, in practicality, it's a very easy target to achieve, because in pain medicine, we try lots of options, and each and every drug has got its limitation, its associated problems and complications, and therefore almost every patient in chronic pain medicine has tried much more than two options. So that makes it an option almost to everyone with chronic intractable pain problem. The safety of cannabis has been established by the use of this medicinal approach in countries who started that usage good 10 or 15 years ago. Canada is by far the most advanced country in using those medications, and there are hundreds of thousands of patients on significant amount of dose of cannabis-based medication in Canada over the past 10 years. And the number of reported incidents or problems with its use is by far much less than any other commonly used drug in the treatment of pain. Definitely, it's a much safer option than the opioids, which is kind of the main group of medication used in treatment of pain. The safety of cannabis-based medication is much well tolerated and much well established than the opioids, where we know the potential harm and damage, and yet we are consistently and continuously using it. Cannabis-based medication target the endocannabinoid system, and in pain medicine, it offers a new limb in controlling the pain propagation into the central nervous system with much less side effects profile and much less dependency and tolerance that happens compared to opioid medication.